If you're someone working in aesthetic medicine who secretly wants to teach one day, this episode is for you. Maybe you don't have huge visibility yet, but you feel you could become an educator or even a KOL in the future. Today, we will talk about what it really takes to become a credible KOL in aesthetics, not just popular online. Welcome to Elevate to Mastery podcast. My name is Dr. Jakov Jurčević, and I'm an aesthetic doctor and an international trainer from Croatia, and I will be your host today. With me is Professor Reha Yavuzer, plastic and reconstructive surgeon, international KOL and thought leader with many years of global training experience. Today, we are talking about how you actually become a credible KOL. This conversation connects directly to what we work on in our Elevate to Mastery journey: identity, influence, and authority as an educator and KOL. Thank you so much for joining me today.
Jakov, dear friend, thanks for having me for this very exciting podcast.
Really a pleasure to be here today with you. Let's go back to the beginning. Who were you before you became a KOL?
Well, that's a very interesting question, and I'm going to take you back, to my past. I finished my residency in Turkey, which was a kind of a combined plastic surgery program. It took 6 very long years, tons of night shifts. Then afterwards, as a junior plastic surgeon, I started to work and from time to time attending the meetings and congresses. And throughout that journey, I always, admired the ones whom I was getting training from. That initiated kind of an internal motivation. I said to myself, one day I should be on that stage. That's how that small seed of educator was implanted into my soul. Of course, throughout that journey, I had plenty of great professors whom really gave me a hand and gave me the opportunity to be on that stage as an educator. And believe me, I did tons of mistakes throughout that journey, no doubt. And from all those mistakes, I started to learn. So it took quite a long period of time for me to get a mature educator and then later on a key opinion leader over the time. Then I realized that the pathway that I had been through was so long. I said, maybe I should help others to make that journey in a much shorter period of time.
So what I'm hearing is that you first realized when you saw on stage someone that you considered a mentor or a role model. When you started, was there ever like a moment when you felt you didn't belong, that you were maybe not up to the conversation or a place at the table, so to say?
Of course, many times, my friend. Not only my skill and knowledge was not good enough to cope on that table, but also my confidence was lacking. So I wasn't really truly believing in myself. I couldn't really see myself on the podium teaching others. Who the heck I was to go on the stage and tell others to do something in a certain manner. So it takes years to build up that. And that's a kind of a nice pathway that you need to go through, collecting both hard and soft skills. It's not only just the techniques that you use. It's not like surgery or injection or a kind of a laser device that you need to know to use. But also the soft skills becomes important, because to know one thing is totally different than to able to teach what you know. So that's two different things.
And so what did you do about that feeling? How did you overcome that, maybe a fear or a lack of a little bit of confidence in those abilities?
In those years, of course, there wasn't a real good pathway that we can follow. So we ended up, having tons of failures. Every unsuccessful attempt, I was sitting down and thinking about what I should be doing, what I did wrong, what went wrong, how could I improve this? And then, with those failures, I start to learn how to become more successful when it comes to the education and training. Of course, that was kind of painful, From time to time, I lost my confidence. I told myself several times that, forget it, you can't be an educator. Maybe you know it, maybe you know how to perform that surgery or that procedure, but to teach is different.
Exactly.
And then I started to overcome this problem. As practice makes perfection, the more I went through this path, I started to collect the information that I need to gather in terms of soft skills. Then I started to become a little bit better. Interestingly, some of your colleagues, professors or educators that are around you also gives you the support, gives you the positive and the negative feedback, which makes you to grow into who you are.
Of course, started to work as a doctor, as a surgeon. You started doing surgeries and residencies. But as you said yourself, it's something completely different than teaching or inspiring others. So what had to change in yourself to make that shift from a practitioner to an educator or a KOL?
At that point, I had that motivation. I want to do more. I want to do more than just performing something. I want to have a more impact around myself, not only towards my patients. I always admire people in the history who really changed the flow of the world. And I said, okay, within this field, can I be one of them? So that was the initial stimulation in my side. And with that, I said, okay, I might be performing great surgeries or, procedures, but how many patients I can have? 1,000, 10,000? I can't have 1 million, right? So, but if I have 1,000 colleagues of mine who gathered the information through my own pathway, then I would able to touch that 1 million patients. So that was the type of ambition that I have inside.
So from a practical point of view, for somebody who is, let's say, a good injector, what do you say it's an important shift to make internally for them to start seeing themselves as a someone who can teach others, inspire others, such as yourself?
I believe that each one of us should be an educator, and each one of us has the potential to be a very good educator. However, we need to scratch that from our inside, and we need to able to grow that plant or flower. It could be intentionally organized. This is like this, I can throw a big Lego in front of you, and if you don't have the instruction booklet, you might have very big trouble to put all these small pieces into one big, nice, model. But if I, show you how to perform it, that journey is going to be very easy. And also at the end of the day, you're going to create the right model that you need to be creating from those small pieces. Being an educator is just like that. And once you started that path, then you will start enjoying. Because to share the knowledge is like sharing a love. So that passion makes you better. Once you become better, of course, the services, the procedures, the surgeries that you give to your patients become better. And overall, then suddenly you realize that this is a kind of a double way roads, which you give and gain. And at the end of the day, the next morning when you wake up, you become better. So I do believe that if you want to be a good clinician, you need to be an educator. If you want to be a good KOL, you need to be a good educator, and you also a clinical practitioner as well. At the end of the day, all these support each other. So it's a kind of a very nice life cycle in a way. Of course, some of us has the ambition to do other things, and maybe you don't have enough time to dig into the path towards the education. Then you might fail. But that's not because you don't have any skills regarding that or, ability or capability. It is just because of lack of intention or time.
That's a great point you had there. So what I'm hearing is that it's not only a technical mastery that you need, but you also need to start first seeing yourself as somebody who wants to teach other people and inspire other people. And then you need to develop a lot of soft skills and different skills from the technical ones. I got that you had a lot of trials and errors in your journey. So hopefully the KOLs of the future will have it a little bit easier with the programs such as this.
Exactly. When you look at the mirror, you need to understand whom you're looking at. Is the identity that you're seeing in that mirror is the one that you want to have. If you want to shift the identity, then there are paths that we can, help you out regarding that. Shifting from a practitioner towards educator is a kind of a effort that you need to put intentionally so that road is going to be quickly happening and opening up new doors in front of you. The more impactful we can be on our society, then we able to fulfill our responsibility better.
Mm-hmm. So when you decided to make that identity shift and to step into the role of teacher and KOL, do you remember your first proper teaching session? Was it a small group? Was it a congress, a workshop? And how did it go, honestly?
I do, of course. I can't forget about it, but still, because, it's a kind of a very embarrassing misadventure of mine. That was my first year after my residency. Mm-hmm. I was practicing in US at that time, and my prof, whom I was working at, gave me a topic. And, just like yesterday, I remember the topic. I even remember every single slide that I prepared. So I really prepared a lot, and that was a kind of an international meeting in US. So I was kind of scared. I'm not, sure about, my English, my slides, the content, and everything. So I went on the stage. I rapidly tried to finish up everything. My slides were, damn crazy busy. Tons of written words, sentences. There wasn't any structure flow. And with a shaky hand, I was trying to read it from my papers. It ended. 45 minutes or so. Mm-hmm. I was so scared, even not able to look at the audience. Mm-hmm. Fortunately, nobody asked any question. So I said, okay, done. Anyway, that was a very early morning session. And afterwards, we had surgeries. We went to the changing room. Mm-hmm. We were going to go into our scrubs and then move into the OR. I was looking at my boss. I was, desperately waiting for his feedback. He didn't say anything. I really worked hard on that lecture. Mm-hmm. So I said, how was it, boss? Did you like it? He said, no. Oh my God, that was the end of the world. So I was so afraid to say or ask why he didn't like. Mm-hmm. So the surgery finished. He said, boy, let's go out. We're going to have a drink. So with that, a few drinks, he step by step told me about all the mistakes that I did, starting from slides, content, my speech, pronunciation, body language, the dress, all those things. So that was kind of a very big course over a couple of glasses of wine. And then from there on, with every single lecture or education, training, whenever I'm on stage, small, large, meeting, congress, I tried to improve myself. So I told myself that every single time I should be better than the previous one. And still, I'm trying to keep that promise to myself.
So with the conversation with your mentor, you actually realized that it's not just enough to give out information on the slide and talking. So do you have any points at what changed in your teaching after that? How exactly did you change the way you teach?
It's not any information, because especially for today, if you need any information, go to ChatGPT, right?
Yes.
Or go online. So what is the role of an educator? So you have to have more than information. What is that? The real impact is totally different. You need to be authentic. You need to be yourself. You need to be unique in a way. You need to be honest, decent, but you also need to have a strategy. What is the message that you want to leave behind? What kind of impact you want to perform? So it's not about the educator. You shouldn't be trying to show off on the stage. It's not about you. It's about your, trainees that will go out, and after they go out of that lecture or training, they should be able to do something differently in their own practice. So you need to create a kind of a algorithm saying that, okay, throughout this training, I want them have this kind of an impact in their own life. Then, of course, once you put that as a task or goal, you need to create a kind of a scheme which will allow you to pass the right message, right skill, whatever, to those. Whether that's a kind of a very nice signature presentation, whether to make them remember what you're talking about, that might be a storytelling. And with your own presence on the stage, you should able to pass that information. And moreover, that information that you pass should retain in their memory. If all these is going to happen, then the next day, when they go back to their own environment, they will remember, Jakov told this like that, maybe I should try. Of course, that will come from, technical information, anatomy knowledge, maybe some hand skills. All those things will be involved as well. Of course, from time to time, you need to measure. You need to get the positive and the negative feedbacks, because your understanding about how you perform might be totally different than, the audience or the trainee's perception about how you perform as well. So it's a kind of like a living organism. It never ends. That is the beauty of being a teacher, being an educator. And not only that will make you go through a totally different pathway, but also that will have a huge impact on your practice. Because, think about this. When the patient walks in, when you're performing a consultation, what do? You basically train the patient. You basically educate the patient. You work in an environment, whether that's an office, clinic, hospital. There are a lot of team members around you. What do you do so that they will perform properly? You train them as well. So medical training or professional training in the aesthetic field exists when you deal with your patient, when you deal with your staff members, and when you deal with your colleagues. Once you understand the value and once you understand the strategy regarding how to perform or become the right educator, whether you don't use that skill on the podium or you didn't even become a KOL, still you become a much better practitioner in your own area. However, if you take the extra mile and if you become an expert, if you become international KOL, whether you want to pass the soft skill or hard skill, it doesn't matter, then your impact becomes bigger and bigger and bigger, which is the greatest thing. I think that is the real joy. That is the real signature that you can leave behind even after you die.
I loved how you say that that we teach and we educate a lot in our day-to-day work and what we do as both as a teachers and also as practitioners. So, and I love that you mentioned storytelling. And so how did you make that shift and how did you learn to use stories instead of just maybe showing like before and after cases or techniques or something like that. Did you find that the audience responds differently to it?
Children learning and adult learning are two different perspectives. Yet, there's one common identity in both of those, storytelling. If you attach any kind of knowledge relating to a story, that retains in our brain much more than just a solid or dry information. So you can show us tons of before and afters like this, we won't be able to remember. But if you tell a story related to even one single patient, we can retain that in our memory. Once you retain that information, not only that triggers the change in our practice, but also that will help us to relate the potential cases or problems that we will be facing in our own daily practices. Because again, going back to the adult learning, if we relate any kind of the education on complications, on cases, on problem-solving issues, there will be more acceptance from our trainees. So once we got that story and applied to our daily life, then that information that belongs to you now is going to also belong to me. And that is the core idea about the whole, goal of being an educator. However, storytelling also has its own limits. If you're giving a lecture or training, if you start with a story and continue with the story and end up a story, well, where's the core knowledge? So from time to time, you need to use that to make that part more memorable, but it should have a purpose as well. So like, telling us stories of nonsense or giving tons of jokes is not making us, remember things. We might have great entertainment. We might really laugh quite a lot or enjoy your talk. But at the end of the day, remember, the main responsibility is able to increase the overall standards within the aesthetic field. Overall, if we have the positive impact, the standards of care that we are providing to our patients or to our society should be raised. That's our, role. We are the ambassador of the aesthetic field, and as the ambassadors, we need to keep a global peace, and our global peace is the high standard.
I really like how you mentioned and how you accentuated the added value that you provide and try to provide with everything that you do. And to maybe just finish this sentence with like a practical pearl, what are like the three things that you almost always do to make sure that any session that you do have a real impact?
Whenever I'm preparing something, I try to do a couple things. Number one, what is going to be the take-home message? What I want you to remember if you are going to only remember one thing, technique-wise. Number two, what is going to be the surprise effect? Because if I add any kind of a surprise effect, just like the storytelling, the impact of being able to retain the information is going to be higher. Number three is how I can create more curiosity. So the end point of that learning session is not going to be at the end of that session. If I scratch your curiosity, then you should be able to go home and read yourself as well. So those are the three things that I always try to implement in whatever I'm trying to do. Am I successful all the time? Of course not, but I'm still improving.
Well, intention counts for sure. And I think this will be a great addition for our audience. And when we talk about KOLs and when we talk about this whole topic, we always mention visibility, and a lot of people are concerned about their visibility and the followers on social media and being well known among patients or community of doctors or something else. So in your opinion, what do you think actually makes someone a credible KOL, not just, being well known on social media?
Very good point. And sometimes we misled with some of our perception. So whenever we are judging anything, we shouldn't, create a box and put our brain into that. We should go beyond the limits to see the reality. So for any valuable KOL or educator, we need to see the positive impact. And if whatever you are passing as a knowledge towards me is a valid, usable, useful information, that will stay for a long period of time. If it's just a big bubble, which is created by the social media, that's going to disappear in a very short period of time. So then, if you create multiple bubbles in a row, your credibility is going to go down. Not only among your colleagues, but within the society as well. You might maybe end up getting certain financial benefits, but is it the money that you're only chasing after? What is your goal, or what is your task in the life? That is why looking to the mirror and figuring out your identity and what kind of identity or what kind of personality that you want to see on yourself becomes important. That is why everybody has a very good potential to become a KOL, but not all of us will become a KOL. And when we talk about the KOLs, don't take it as a title. Don't take it as a kind of a status. It's a kind of a lifestyle in a way,
True, yeah.
So if your name is on a scientific program saying that, well, Dr. So-and-so is the KOL of such and such, that doesn't mean anything. Exactly. Are you going to have an impact on my professional life? If you do have, then you're a KOL. Even if there is no title in front of your name saying that you're a KOL of something, but you're having an impact on my practice, maybe during a coffee break, still you are my KOL.
I loved what you said. And I think when we look at the industry, we see a lot of people who actually chase the titles and who just see them as a stepping stone to something that we don't know what the end game is. I love how you mentioned adding the value to everything that you do. And if I understood it correctly, you think it's very important to invest in long-term success and the long-term visibility, so to say, as your KOL. And I know you worked closely with the industry for a long time, but you clearly kept your own voice as an independent voice. And how did you avoid that to just be seen as a brand speaker in the industry? And how did you kept your voice and what helped you stay independent?
Well, you zoomed in a very important area. To be a speaker for an industry doesn't mean that you're going to say something that you don't believe. So, of course, our partners in the industry are very important, and that's how this area, this field of aesthetic is growing. Whenever you become the speaker, please be independent and also stay as authentic as possible. That is very important. Well, if you become independent and authentic, that doesn't mean that you're not going to make any mistake, but those mistakes are not going to be intentional mistakes. Once you take your personality into whole picture and try to help your colleagues not to mislead them intentionally, then your role is done. Of course, industry is very important. Why? Because they have a much wider insight than one single physician or practitioner can have. They have multiple spots around the globe. They acquire tons of data. They filter those and they help the field to grow. Because in this path, industry and the practitioners are working hand to hand for the sake of the society. We know that aesthetic is very important because that empowers our patients, that empowers the society, that increases the self-confidence. Well, if your self-confidence goes higher, what's going to end up? Much healthier society, happier society. So that's our role. So although many people accept that aesthetic is luxury, I don't agree. You know, aesthetic is a must to make you happy. And if you become happy, you'll be more productive in all manners, both socially or professionally. It doesn't matter. Well, to able to perform that, stay unbiased. Whether you talk on behalf of a company or industry, it doesn't matter.
So what I heard is that you would maybe like a little tip would be to align with the companies that you share values with, and that you can, you know, get backed up by them, and that you can back up. Moments when you said no for certain topics, no to certain formats or collaborations, were there any to protect your credibility?
Of course, you know, this is just like practicing. Well, there are patients that you will say no because their expectations are unrealistic, or you feel that you're not going to be able to fulfill your responsibility towards that patient, and you're not going to be able to make that patient happy. Just like that, whenever the industry of any partners came towards you and asking something that you don't believe in, or you think that that's not for the sake of the patient, of course you're going to say no.
If somebody is a young injector with like 2 or 3 years experience, and if he or she wants to grow in education, what should they focus on in the next, let's say, like a year?
I think, you know, first of all, for a young person, there's a very big chance of becoming a KOL and have a huge impact on the future of the aesthetic field. So I will encourage all of them to go through this journey, which not only will improve themselves, but also will have their impact go to the next generation as well. What they should be doing, they should carry multiple different hats. And for all those hats, they need to work hard. On one hand, they need to collect the basic, you know, knowledge, like, you know, science, anatomy, you know, the product features, whatever they are using, and also understanding the physiology of the patients. Number 2, showing the empathy and then understanding the patient needs, not only physically, but also socially. Number 3, like the first 2, going through a strategic pathway, becoming an educator and KOL, strategically learning how to pass the information, how to get the soft skills, how to change the identity, how to, you know, incorporate the tactics of, you know, storytelling, presence, you know, and other issues regarding the educational sessions that they might have. And at the end of the day, once you combine this mixture, once you know, create all this into the melting pot, then you become a real practitioner with all different capabilities, performing whatever you are doing in your daily life, whether that's practicing or educating.
I could not agree more with all of those tips. And you mentioned great 3 tips. And what would you say would be like another 3 tips what not to do when you are a young professional trying to...
Well, not to do things are more than what to do things, actually. Number 1, I would say, you know, be patient. This is like growing a plant. You seed it to the soil today. Tomorrow you're not going to be able to collect the fruits. You need to wait a few seasons. So continue growing yourself, continue investing in yourself in terms of knowledge and skills. And it takes time. But you know what? If you're able to show the patients for that time to pass, the fruit that you're going to taste is beautiful, amazing, splendid. So enjoy that fruit once the season arrives. The second thing is, this is a continuous path. Never say that I'm done. If you say that you're done, then you're really done. So you really need to continuously grow and believing in the continuous medical education in the field, whatever you are going to do. Number 3, open your ears and eyes. Get as much as you can from others and then share not only your good side, but also your mistakes as well. Because one can learn from also to-dos as well as not to-dos.
Perfect. I think we've covered a lot today, from your early days to how you see yourself as KOL. If you think about someone watching who might be from a smaller market or an emerging market, what would you like to tell them as like a short final message?
Well, size doesn't matter. What matters is what you know and how you pass that knowledge. So you can be from a very small city. It doesn't matter. You can be from a country in whom the aesthetic field is not that much mature. It doesn't matter. So what matters, as I said, how precise you are in what you're doing and how you collect your data and how you pass that information.
Thank you so much for sharing all of this so openly. If this conversation resonated with you and you see yourself as a future educator or KOL, you're exactly the kind of person Elevate platform is built for. We'll be going deeper into topics like identity, influence, and authority in our curriculum. Thanks for watching and see you in the next episode.